July is Bone Cancer Awareness Month. Although rare, it can be a difficult diagnosis for those who encounter it. Bone cancer is a growth of cells that starts in a bone but can spread to other areas in the body. Dr. Matthew Steensma is Section Chief for Orthopedic Oncology at Corewell Health, and he joins us today to talk about this cancer and share insights. Thank you for being here with us this afternoon.
Thank you.
So we know it's rare, but maybe can you share with us some numbers about how many people are diagnosed with this cancer?
Yeah, there are basically two types of bone cancer. One is a cancer that starts in an organ and spreads to bone, and that constitutes about 99% of bone cancers. And really any cancer that has a proclivity for bone, like breast cancer, prostate cancer, lung cancer, melanoma, can go to bone, and those are some of the more common cancers. On the other hand, cancer that starts in the bone is very rare. Less than 3,000 people per year in the United States get primary bone cancer.
So what causes it? Are there hereditary risk factors?
In most cases, it's a combination of genes, but more likely the behavioral issues like smoking, obesity, alcohol use. But there are inherited forms of bone cancer, particularly the primary bone cancers, which are quite rare.
So talk about the symptoms and signs to look out for.
Yeah, anybody who has a diagnosis of cancer that has an ache or a pain that's not near a joint, like in the middle of the arm or the middle of the thigh, that could represent cancer that's spread to bone. Many times these are silent lesions that are picked up on surveillance scan as people are being monitored for their cancer treatment.
Who should be most concerned about the risk of cancer for this bone cancer?
Yeah, the people at most risk are the people who have diagnoses of bone cancer. Children very seldom get bone cancer, but that is the age group where we see the primary bone cancers. I think in terms of the risk to the general population, if you keep the excess pounds off, you drink alcohol in moderation and eat a good diet, your risk of bone cancer can be diminished.
Is there a specific age where you should be screened? How does that go about?
Yeah, usually your primary care doctor is screening you for most cancers, mammograms for breast cancers, colonoscopies for colon cancer, et cetera. There really is not a particular screening test for bone cancer, but if you are diagnosed, then you'll be under surveillance and receive blood work, receive imaging testing that would find it.
So talk about, are there any treatments, new research taking place at Corewell Health right now?
Yeah, the cancer field grows at a very fast pace, and right now there are very cutting-edge treatments for cancer that really kill the primary tumors, but also kill the cancer that spreads to bone well. The most exciting innovation has been the immunotherapies, drugs that activate our immune systems to kill the cancer. It works as well in the lung or the kidney as it does in the bone, and so we're doing fewer and fewer surgeries on bone cancer because of the success of these medicines.
Okay, Dr. Steensma, anything else that you wanted to share? What are you seeing here in West Michigan when it comes to bone cancer?
Yeah, bone cancer is something that does require specialists to treat. The Corewell Health System has a whole team of physicians and physician assistants and nurse practitioners who have expertise in bone cancer. The community care here is extremely good for cancer, so contact your local physician if you have a concern about bone cancer or if you've been diagnosed with it.
Okay, anything else that you want to add?
No, thank you for your time.
Thank you for coming on. We appreciate it.
You bet.